The abdominal pelvic cavity is pretty big. So in order to make it easier to identify the location of a specific abdominal or pelvic organ, we can divide the abdominal pelvic cavity into regions and also into quadrants. When we subdivide it into regions, we have 9 different regions. And when we subdivide it into quadrants, as you can expect, we have 4 quadrants. So the anatomists prefer the abdominal pelvic regions because you can be very specific about the location of any specific organ. And health professionals, they primarily use quadrants to describe the location, the site of a tumor, of pain that the patient is feeling, for example. These 2 images are showing the 9 abdominal pelvic regions. In one of the images, we can see them at the surface of the body, and in the other image, we can see the internal organs. The name of the 9 abdominal pelvic regions makes sense, and I'll explain to you why they make sense shortly. But before we go into that, I would like to point out that you must look at these images as if you're looking at your patient. So this will be the right side, and this is the left side of the patient. Is always the opposite. So the patient is facing you. That's the anatomical position. So anything on this side will be right and anything on this side will be left. Now, these 2 top vertical lines, they are drawn based on the midpoint of the clavicle, the right and left clavicles. And the clavicle is the collarbone. So these lines are drawn like that. The top horizontal or transverse line is based at the level of the lower part of the cartilage that makes up the 10th rib, as you can see there. That's the cartilage. And the bottom transverse line is based on the superior aspect of the hip bone. So when we look at this tic-tac-toe, we can see that we have this hypochondriac region on the right and left sides. And this name makes sense because, as you can see here, we have the cartilage, right, in blue. And that is the region that is underneath the cartilage, hypochondriac, because the root chondro means cartilage. So you have the right and the left hypochondriac regions. Then when you go into the lumbar region, you have the right and left lumbar regions. And when you're going closer to the groin, you have the right and left inguinal regions, because inguinal is related to the groin, right? Also, the right and left inguinal regions can be called iliac regions, because ilium is the name of one of the bones that make up our hip. When we look here in the middle, we have the epigastric region at the top. So epi means above. You can remember the epidermis is above the dermis. So the epigastric region is the one at the top. The umbilical region, as you can see, is at the level of the navel, the belly button, which is the umbilical. And lastly, we have the pubic region, which is making a reference to the pubic bone, which is another bone that makes up our hip. When we look at this diagram, we can see the different organs we find in each region. But for test purposes, I would like you to focus on the organs we find in each quadrant and not in each region. Here you can see a comparison between the abdominal pelvic regions and the abdominal pelvic quadrants. To draw the quadrants, we have a mid-sagittal line and a transverse line that intersect at the level of the belly button. And this leaves us with 4 quadrants: the right and left upper quadrants and the right and left lower quadrants. Since abdominal pelvic quadrants are primarily used by health professionals, I would like you to remember the organs we find in each of these quadrants. As you can see, in the left upper quadrant, we have the stomach. We will also find the spleen and the pancreas, basically hidden behind the stomach. When we look at the right upper quadrant, we can see a big chunk of the liver. Specifically, we see the right liver lobe. And underneath this right liver lobe, we would find the gallbladder. We can see that the transverse column is basically going across the right and left upper quadrants. When we look at the right lower quadrant, we can see here the cecum. Behind the cecum, we would see the appendix, and we see a portion of the ascending colon. Consequently, we can say that the proximal end of the large intestine is found at the right lower quadrant, and the distal end is found at the left lower quadrant, because we can see here the descending colon. So these quadrants are clinically relevant because if a patient complains of pain in the left upper quadrant, that can indicate a problem with the spleen, because you know that the spleen is found within the left upper quadrant. And with that, we finished the first chapter. Please let me know if you have any questions. See you in lecture. Bye!